Since it began in 2016, AllCan has emphasised that efficiency in cancer care means focusing resources on what truly matters to patients, whether that's time, for example time to diagnosis, quality of life or other better outcomes. And that's why we created the Efficiency Hub, a first-of-its-kind platform that collects and shares best practice examples from across the entire cancer pathway. We hope that these examples provide inspiration for action so that we see these successes replicated across different contexts to drive meaningful change. So let's have a closer look at one of these examples featured on our website to see how efficiency can truly transform patient outcomes.
As we know, lung cancer is responsible for the most cancer deaths around the world. Also is the leading cause of cancer death across Canada and in Alberta, where the most affected are low-income patients and those living in rural and remote areas, particularly the Indigenous communities formed by First Nations, Inuit, and Métis communities who have the highest incidence and the lowest chances to survive lung cancer. In Alberta, late detection remains a significant issue. About half of lung cancer cases are only diagnosed at late stage 4, with a 5-year survival of just 13%. The Alberta Thoracic Oncology Programme stands out as a leading Canadian example on how system redesign can accelerate lung cancer diagnosis. Before ATOP, the core system challenge was that too many patients were diagnosed late. This was particularly impacting patients in rural and remote areas where there is a shortage of oncologists and diagnostic facilities. These essential services remain unavailable in certain regions, forcing patients to travel long distances. ATOP model was created in 2011 by Dr. Alain Tremblay to address system-wide inefficiencies by centralizing and coordinating the diagnostic journey. We must mention that ATOP could not be possible without the support of Alberta Health Services, the Cancer Care Strategic Clinical Network, and Cancer Control Alberta. The ATOP program brings together a multidisciplinary, innovative model. Teams formed by thoracic surgeons, interventional pulmonologists, radiologists, pathologists, and oncologists are supported by 3 specialized nurse practitioners and 1 clerk, together handling more than 3,000 referrals per year. The most impactful innovation of ATOP is the introduction of referral pathways. Radiologist-initiated referrals can directly refer patients to ATOP by a single click of a button, reducing the time from suspicious images to referral from several weeks, 23 days approximately, to just a few days, approximately 4.7. This represents a meaningful reduction in overall diagnostic delays. To accelerate access to specialist care, ATOP has implemented an automated radiology software that enables specialists to review cases in a fraction of the usual time. Once referred, ATOP nurse practitioners coordinate the full sequence of diagnostic tests and ensure the tests occur in the right order. Alberta is now strengthening ATOP by expanding access to advanced procedures. It is increasing telehealth-based triage for rural and northern communities and integrates ATOP more closely with the provincial lung cancer screening program. Several lessons from Alberta that translate well internationally. First of all, equity must be intentionally built in programs, especially in provinces or countries with Indigenous population or high linguistic diversity. Improved access in underserved regions is a must through mobile diagnostic units or telemedicine-assisted referrals. Essential lessons are also linked to radiologist-initiated referrals, multidisciplinary teams, and centralized nurse practitioner coordination. Last but not least, a real-time data sharing among providers for early and equitable lung cancer diagnosis is an important part of the success of this innovative model. Overall, ATOP demonstrates that redesigning pathways can produce faster, more consistent, and more equitable lung cancer diagnosis in Alberta.